If you're traveling, feeling bad, or just trying to be safe, a COVID-19 test that's run in a lab is probably the best way to figure out if you're infected. But that's only if you understand how to interpret the results, especially if it doesn't come back positive or negative. Here's Abby Larico with what to do if the answer you get isn't really an answer at all.
Scoring a COVID-19 test appointment can be complicated. Turns out the results can be complicated too. PCR tests, or polymerase chain reaction tests, are processed in a lab and considered the gold standard for determining if someone has COVID-19. Positive and negative tests are pretty much self-explanatory. But what if yours comes back inconclusive or indeterminate? The director of the SSM Health microbiology lab says there are several reasons that a test can give inconclusive results, depending what type of test, specimen collection, method of testing, limitations of the test, and the manufacturer of the test. For example, maybe not enough sample was collected to run the test properly. Maybe you're testing too early or too late in your infection. Or perhaps the type of test looks for specific markers of a positive case and detects some but not enough in your system to draw a conclusion. So what do you do if your test results aren't really results at all? Typically, you will need to take another test. It's frustrating, but recommended by health departments and labs across the board. And then
we need individuals to act as if they are positive, because that most people will get tested because they're either symptomatic or they know they've had an exposure to someone who is COVID positive. And so we need to make sure that we're doing our very best to protect the other individuals in our community.
Which means for the time being, it's best for you and for others to self-isolate. Abby Larico, 5 on your side.
Looking for a swab test, text the word test to 314-425-5355 for a list of local COVID test sites.